we have to like, like incorporate AI into like our daily life. And, kind of like take things like what we find on the internet with like a grain of salt.
Hmm.
And then, somewhere along the line, I mean, there's also like virtual pelvic health too, right? That where you can, someone who's like in a healthcare desert can also virtually talk to or have an assessment done by a pelvic PT. So hopefully, like AI would kind of like be more complementary in saying that, well, like it could be these symptoms, it could be like these conditions, but they're not diagnosing it and saying like, it'll be a good idea um, to maybe even just do like a consultation, like a virtual consultation with a pelvic floor PT.
Hello, everyone. Welcome to the Everyday Pelvis. My name is Juanita Benedict. I am a doctor of physical therapy and the owner of Athena Pelvic Therapy. I am so excited about today's episode. I have been thinking about this for a long time, and when I was trying to come up with some episodes, this was at the very top of my list because we're going to be talking about AI and pelvic floor therapy. To join me or to join with me in this conversation, I have a fantastic guest who's a great friend of mine. Her name is Dr. Helen Kim. She practices on the Upper West Side in New York City, and we've met through a course and have just been sharing clinical information since. And I'm so excited to have her here and her expertise. So, Helen, I'm so glad that you could join me today as we delve into what's going on with this new technology and how it really affects our patients and their outcomes and what that means for living in the real world.
Hi, Juanita. It's nice to be here. I'm so
Yes.
excited today.
Good, good. And then Helen, you have your own practice up on the Upper West Side.
Yes.
So we'll put your contact information down in the comments if anybody wants to reach out to you for any reason. That way they'll have access to you.
Fantastic.
Great. Okay, so I just want to dive in. Let's get started, okay? Um, I don't know about you, but I would say over the past 6 to 9 months, I've had many more patients come in to me with some research already done. Now, before that, we would call it Dr. Google, right? They would come in, they'd Googled their symptoms, and they have all of these ideas. But AI seems to have changed that in that people not only come in with ideas as to what's happening with their pelvic floor or with their symptoms, but also like things that they've tried and different strategies and techniques. Have you experienced that as well?
Well, I feel like AI is everywhere now. You can't avoid it. And I think that instead of Googling, a lot of times people just find it much easier to use AI, such as like ChatGPT for like, any questions that they have. So I've gotten like quite a few like patients who, they tried maybe like following some advice, like, from like ChatGPT. And if it was like unsuccessful or they wanted more information, then they sought out a pelvic PT. So hence they end up at my office.
Yeah. So one thing is really interesting. I am a little bit of a tech, I don't know what, tech freak, tech weirdo. I don't know. I really enjoy following the new technologies. So I've been using AI for different things for actually several years actually. Um One thing that I learned early on is your prompts really matter. They really make a difference
Yes, it
as to what
does.
kind of information you get, right? Have you ever had any experience with like prompting something and you come up with something completely different than what you were expecting?
Sometimes I feel like you have to be like very good with wording, but the thing with like ChatGPT is that it's great in like they prompt more like specific commands. So like, for myself also, like I've let's say like, I was like searching for like symptoms and they're like, well, do you want to like, be like more specific and like and it would just kind of like almost kind of guide you through like a diagnosis or like a solution.
Mm-hmm.
Um so it's like, yeah, I feel like sometimes like it can just be like it can give you like too much information. And then sometimes it can like lead you to actually a more like specific direction. So it really depends on how you use AI.
I think that that's kind of the point, is that different people are going to have different skill levels when it comes to prompting. And so it can be difficult for some people to get information that's correct for their symptoms, because sometimes, and you know this, being a pelvic floor physical therapist, sometimes there are symptoms that seem completely unrelated to what's
Sure,
going on in the pelvic floor that are very much related and important for us to address, in order to have the best outcomes.
sure.
All right.
Um, it's funny because like I've actually I tried ChatGPT and like asking about like, oh, like like my background is such and such, and like I'm experiencing like leaking. Um, what sorts of treatment plans or like exercises do you recommend? And ChatGPT, it was nice because it kind of gave like very like general conditions. It's like this is what it could be. These are like the exercises or treatment plans that are out there. And I noticed that pelvic PT was considered like the gold standard for treating these symptoms. So I feel like for the most part, again, it's like it can be like, very general to specific depending on like what you're looking for,
Yes, depending on what you prompt, right? What you put
depending on what
in
you
there.
prompt.
Yeah,
Correct.
what you put in there. Okay, fantastic segue into what we want to do next. So I thought it would be really fun to just throw some prompts into both ChatGPT and Gemini and see what they have to say. And then you and I can go through and look and see what is good advice, maybe what they missed, or maybe if they've gotten something incorrect or wrong. What do you think? Sounds like a good
Yeah,
time.
let's do it.
This is what pelvic floor PTs do for fun, right?
Yes.
Okay. So the first response, and I actually use the same response in both Gemini and ChatGPT. That way we could get an idea as to what both of them were going to say. They're both very similar in their results. So I think let's start with the Gemini responses. So the first prompt, and I know Phil's going to put this up on the screen here, but the first response was, I'm sorry, the first prompt that I put in was, I pee when I laugh or cough. Can you tell me what to do to fix this? I feel like that's a common symptom that people will come in with. It's called stress
Mhm.
urinary incontinence. And I feel like that will typically be the symptoms that they identify when they have that. Would you agree with that?
Yeah, definitely.
Okay. So then we've got the answers from, we'll start with Gemini, okay? Of course, it talks about how frustrating it is, because any AI is going to tell you that you're awesome and you're great and trying to empathize with you and tell you how amazing you are. It's okay. So we got that little response there from Gemini. And then it says the first thing we need to do is strengthen or do Kegels. And then it gives you a little bit of a program for that. The second thing is called the knack. We'll talk about that in a second. And then the third point is lifestyle tweaks, which include weight management, manage your chronic cough, and hydrate wisely. All right, so let's kind of go through it. Um, would you say that these are good strategies? So doing the Kegels, and when they say do the Kegels, just to be specific, they're talking about endurance. So holding for 5 seconds and then letting go. And then the knack, of course, which for those of you who don't know, which probably most of you don't, the knack is when you squeeze your pelvic floor muscles or you do a Kegel and then you cough or laugh or do something against that bracing of the pelvic floor. And then the third point that they brought up was the lifestyle tweaks. So, do you think that those are, first of all, just good strategies that they threw out?
I think those are very good general strategies, but it's like a very general question, right?
Yes.
So we don't know anything about like the person's background. Like, do they have a baby? Are they like postmenopausal age? Is this like a hormonal, like, is there hormonal like influence or part to this? Um, I feel like someone who asked that question would then probably ask like, um, you know, be like more specific and, say like, well, I just had a baby like, 2 months ago, and like every time like I jump, like, I leak or I cough and I leak. And then like maybe Gemini at that point would then say, oh, okay, like maybe this is more because you're postpartum, like a weakness, and a weakness issue of the pelvic floor muscles. But I think in general, like those are not bad answers per se.
Right. I would agree with you. I would agree with you. I think that they're good answers, not complete answers. So even with a prompt like this, I would, you're right. We don't know all the information. So we as professionals would also ask to see if there's more information that's going to tell us if those muscles are underactive, which is what Gemini here is trying to help with, right? The underactive pelvic floor, or maybe they're overactive, right? So maybe the muscles are too tight and maybe they're overactive, because you can have a lot of the same symptoms with like urinary incontinence even if the muscles are overactive. And so there's not really any response or even any initial strategy or even consideration, I feel like, for overactive pelvic floor muscles. And then if that's the case and we kind of keep going down this line of thinking with Gemini for the underactive pelvic floor muscles, and we do these strategies, we work on the Kegels and the knack, and in reality maybe we have an overactive pelvic floor, then I feel like that this is very misleading, and I don't feel like the people are going to get the the outcome, obviously, that they're desiring. In fact, maybe it can make things worse. Would you agree with that? Do you have thoughts on that? Oh, did we lose her? Okay. Okay. Also, the first video you put up was for ChatGPT, and this is the responses. And mm-hmm. Okay.
Hello.
Hey, Helen. Did
I'm
you?
sorry about that.
That's okay. Did you hear my question, or did you hear my thoughts on the overactive versus underactive pelvic floor?
No, I totally missed that part.
Okay. So let me give you just the brief, and then we can edit this part out, Phil, okay? So basically what I was saying is that Gemini just defaults to there being an underactive pelvic floor for these issues, and there's not any consideration at all for there possibly being an overactive pelvic floor that could lead to the
Mhm.
same types of problems. And there's not any kind of guidance necessarily for any kind of overactive. And so if you have people who are going only on this particular prompt and even being led down that road, then they may see actually a worsening of symptoms instead of an improvement of
Mhm.
symptoms, because that's not even a consideration through the AI.
Right, right. I believe like along the same prompt though, do they also recommend they're like, well, if you try these exercises and it's not getting any better, but it's actually getting worse, to consult with like a pelvic PT?
It certainly does. Like at the end of the prompt, it certainly says, see a pelvic floor physical therapist. That's the first referral that they offer, or the first suggestion that they offer when to see a professional. And then the second one is a urologist or a urogynecologist. So they certainly do see that. They have that. But I find that people who tend to be doing this tend to be wanting to do everything like on their own, which I understand. Like there's lack of access to a lot of
Sure.
pelvic floor PTs, and I understand the reasoning behind it. It's just a matter of knowing. I guess the whole purpose here is to know that there are deficiencies in the answers.
I mean, that's definitely true. I mean, AI is not, it's great to have, but it's definitely not perfect.
Yes.
I just wonder, like, in the next, like, few months to a year, if like the response on like Gemini and also like ChatGPT would be like more sophisticated. So maybe, if you just give it a little bit more time, like they would actually say, well, actually, with pelvic PT, like, it shows that it can also be an underactive, pelvic floor as well. So maybe it's just like a matter of time before AI also picks up on that too.
Yeah, I mean, absolutely. Because the more information that's being fed into the language models, then the more information that they'll be able to pull from. That's for sure. So every day it's growing. It's like this big amoeba that's just sucking everything in
And learning and
and
adapting.
learning. It's a little creepy, but I mean, good in some ways, difficult in others. Okay, so now we're gonna go to the Chat GPT response for the same prompt. So this is, I pee when I laugh or cough. Can you tell me how to fix this? Again, Chat GPT gives its little blurb about sorry that you're experiencing this. It's called stress urinary incontinence. And the thing about ChatGPT, I will say that it does actually give a little bit more information about why it could be happening. So it talks about pregnancy, aging, and hormonal changes, which you mentioned before,
Mhm.
coughing, being overweight, high impact exercise. And I would say that all those are true with regard to why or some why things are happening. Definitely not inclusive of everything. That doesn't. But how can it be? The list would be very, very long if that was the
Right.
case. So, okay. So let's just kind of compare. So the first point that ChatGPT provided was the same as Gemini, which is doing Kegels. Okay. Again, it's for endurance. So that's just the squeezing and the holding for a certain amount of seconds and then letting go. Nothing wrong with that, but there are different types of exercises that are going to be more effective.
Sure.
Right. So, but that's one. And then the other one was the knack, which Gemini said as well, right? And then this one says bladder habits, which Gemini did not say. So bladder habits, like the not just encasing. Did you have you heard that term? Like, is that the term that you were familiar with when you learned, your initial pelvic floor stuff? They call it just encasing. Is that what you call it?
Like just in case, like going to the bathroom. Um, yeah, it's like I think it just kind of falls under like the general like good bladder habit, like model.
Mm-hmm.
Um, like don't like pee frequently because then like your urgency will get worse. Um, but then again, it's like urgency to urinate is still different from stress incontinence.
Yes.
So we're kind of like talking about like two different conditions that may be connected, right? But not
Yes.
necessarily everyone presents with those symptoms together.
Exactly. Exactly. That's a good point. That's a good point. Um, in fact, it can if I'm sure you've had patients who already wait too long to go to the bathroom, and then it's not, oh, you shouldn't go to the bathroom just in case, when really you're like, no, you
Right.
need to
Like you
go
should
more
go.
often.
Right.
I mean, I've had people, I've recently I've had somebody come in and they would wait like 6 or 7 hours to go to the bathroom. They weren't working, retired, but they had just gotten used to waiting that long to go to the bathroom. And I'm like, okay, well, we need to go a little bit more than that.
But then they can have a separate other issue, right? They can have like overflow
Yes.
incontinence.
Yes. So you're right. Exactly. It's a totally different issue.
I find it really interesting how ChatGPT comes up with like more, like a list of like more conditions as opposed to Gemini. But is it because like ChatGPT is a more, I guess, like a commonly used platform as opposed to Gemini?
That's a great question. I'm not sure. So these large language models, which is what AI is, right? they are pulling from their resources. Now, they do share a lot of the same resources. And I was gonna have someone on here. If we do this again, which maybe we will, I have a friend of mine who is an expert in AI come in and talk about like the different types of prompting can lead to different
Mm.
types of outputs. But also, I know that they're pulling from some of the same information. I would say probably most of the same information, but I don't know if it's the information that's different or if it's the actual interpretation of that information that's different. And, why we're getting a little bit more of a larger list of conditions in ChatGPT. I think maybe Gemini just doesn't assume that it knows the conditions. I don't know. That's a good
That's a
question.
really interesting point. Yeah.
Yeah, I would that would be interesting because they're all different, right? So we're using the two right now. Today we're talking about ChatGPT and Gemini, but then there's also Claude and
Hmm.
Phil. What are some other ones out there?
Oh my gosh. I mean, Claude's my main one that I use,
Yes.
but it's Claude, Gemini, ChatGPT, OpenClaw is a new one.
Okay.
But yeah, those are the main ones.
Yeah. Yes. And I'm sure there's going to be a million more that
I
are
feel like for
coming.
me personally, like I use ChatGPT the most, and I have actually not used Claude.
It also goes by what you train it to do too. So if you're using, let's say you use ChatGPT, but same as for Gemini, and I would imagine Claude as well. The more you ask questions, the more it learns what type of responses you're looking for. So it will be more specific. So for me to get these types of responses, I had to go into a whole different account so that it did not have any of my like pelvic floor stuff that I was looking at before, which was much more advanced. So it didn't feed into that because the responses would have been different because I've trained that.
For each individual. So someone who doesn't know anything about pelvic floor PT,
Yes,
just as like a like everyday like lay person.
yes. So their
It's
response is
just like
going to
it's
be different than what mine
yes.
would because mine on my trained AI, because my trained AI already has like resources that I put in there and different types of information and a different level, right? It's going to be more like scientifically oriented, more clinically oriented. But if I was a layperson and I went on that, then the answers would be more challenging to
Does
understand.
True.
does it know that you're a doctor? Do you tell it? Like your personal one, does it know that
I'm
you
trying to think. I don't remember specifically if I've told it. I probably have at some point.
Yeah, tell it. Like ask it to do an audit on you,
Okay.
and it'll tell you all that stuff. But what
Okay.
I noticed though, is Claude is my absolute favorite. So Dr. Kim, if you haven't had a chance to dive into Claude, make sure you do it and do the paid version, just because you'll use up your free credits real quick. But the paid version of Claude, it has a deeper level of thinking too. So it can handle a lot more complex tasks. Whether it's even if you want to build an app for your business, you can do that with Claude. Or if you want to do coding for a website, it'll actually create the website via code if you want to do that. But just in the text versions of it, what I've noticed, even when asking the same prompts and giving it the same information as ChatGPT, it seems a lot more human in its responses.
Mhm.
It's harder to tell because you can kind of tell when you see Chat GPT text that, oh, this is a Chat GPT text. But with Claude, it seems more human, and it's it's different, and it'll tell you. It won't gaslight you and telling you that you're the best person ever, like Chat GPT.
Now,
They'll tell you like, no, you're wrong. You're completely wrong on this.
okay.
And if you tell it that I got this prompt from Chat GPT, it'll say that's trash.
Jeez. Phil, first of all, have you not seen that, or maybe you too, Helen, have you seen that lady? I think her name was Kendra on social media that used Claude as a psychiatrist,
No.
and she had fallen in love with her real life psychiatrist, and then Claude was telling her Oh, it's all over. I think it was on Instagram, or maybe it was TikTok. I don't know. But yeah, Claude was telling her that she was right and that the psychiatrist was in love with her and that everything that he had done, which seemed appropriate to me, trying to set boundaries. It was like, no, he's not really trying to set boundaries. He really loves you and like all this stuff. Like it was correct, kind
Oh
of crazy.
no.
Oh yeah, yeah, yeah. So again, I think it depends on the prompt, right? And like why you're using it and because it was crazy. You need to look that up. But I think that's true in all of these, right? Like I think it's going to be true in all of them because they're all what's the word? They're all trying to make sure that
We continue using it.
we continue using it, but they're always like biasing it towards a positive, trying to reaffirm what it is that you're thinking, which is not always a good thing. And that's a big problem with the AI, right?
Yeah, yeah. Use I use Claude too, like if because I'm used to ChatGPT because I've used it longer than I've used Claude. But if I'm confused on something and I need to figure out, okay, I'm going to be using ChatGPT, I'll make the actual prompt with Claude, and then I'll give ChatGPT the prompt I made from Claude, and then I'll get a better output.
Yeah.
Interesting.
It really is interesting because you can go back and forth between them to figure out like the best type of prompting. Um, the question is a level of like my mother-in-law, I can't even imagine her using ChatGPT, which is okay, right? It's just a different skill, and I'm sure that younger generations are going to be amazing at this. I'm kind of older, so I remember when there was no internet really, and so just learning how to surf the internet was a skill.
You should see how the younger generation uses it, right? It's crazy. They don't actually type to it. They just talk to it. Like because
I
you
know.
can use the microphone. So they'll have full-blown conversations with their Chat GPT like it's a real person. And they don't actually type anything. They literally would just pick the phone up, hit the microphone button, and ask it the questions, and then they'll customize their Chat GPT voice, and like they can name the Chat GPT or
Yes.
whatever. Like, hey, your name is Pat or whatever, and they'll talk. They say, hey, Pat, I need help finding this place, and then it'll just talk to them. That's how they use it.
All right. So you're gonna look up Kendra, and you're gonna see the interesting things that can happen. So not my concern. I think it's very interesting. I think it's really interesting what we can do with AI, like moving forward. I do think it's a great tool for people who don't have access to healthcare for whatever reason. It's definitely better than nothing. I think the concern for me, and I would like to know your thoughts, Helen. I think the concern for me is that people don't don't always realize what they need to put in as far as a prompt in order to generate the treatment that they actually need. And then they don't really have someone there to make sure that they're doing the treatment properly.
Of
And
course.
that's where professionals come in, and they do mention, I think both, yes, both of them, both ChatGPT and Gemini, of course, mentioned pelvic therapy, that they should go in and see that. But that's my concern. Do you have any concern? I love AI, but I do have concerns when it comes to healthcare, for just for lots of reasons.
Absolutely. I think on even like social media, right? There's just like a lot of like misinformation out there. And I think like a lot of people, if they're just like doing a search, just I think they're also just looking for like validation. There's
Yes.
definitely like an emotional, aspect to that too. So I think like pros and cons. They're getting information on one hand, but they're trying to, like I feel a lot of times too with like chronic symptoms, like they're trying to like desperately put a label on something.
Mm.
They're like, well, if I put a label on it, then I'll get a response and I'll get a more, like for like treatment plan on their own. But I think yes, like we have to like like incorporate AI into like our daily life, and kind of like take things like we find on the internet with like a grain of salt.
Hmm.
And then, somewhere along the line, I mean, there's also like virtual pelvic health too, right? That where you can, someone who's like in a healthcare desert can also virtually talk to or have an assessment done by a pelvic PT. So hopefully, like AI would kind of like be more complimentary in saying that, well, like it could be these symptoms, it could be like these conditions, but they're not diagnosing it and saying like, it'll be a good idea um, to maybe even just do like a consultation, like a virtual consultation with a pelvic floor PT.
Yes, that would be great if we could learn to work together, the man and the machine, right? Working together to help people out with their healthcare. Um,
Well, it's like we know that AI will not replace pelvic floor PT, right? It won't replace healthcare. But it's like, again, like people are just kind of using it as like a useful platform in getting like the advice that they need and maybe the direction that they need.
I think so. I've had some people come in who have done some Chat GPT or just AI. I don't know specifically which platform. Who have been convinced that their symptoms indicate something very serious. Um, and it is not it is not within my scope to diagnose serious conditions sometimes, what they were talking about. But then once we just fix some of their pelvic stuff and their pressure regulation and other things that they were having, like those symptoms completely disappeared because I don't think that they were really having those issues. But Chat GPT or Gemini or whoever they were using just kind of led them down this road. And there are some people who do tend to catastrophize things.
That's true.
And so they're going to put everything in, and whenever there's any kind of validation that maybe this is the issue, they it kind of sends them over the edge in some ways. I don't know
But I
if
feel
you've
like it's probably like the same like type of person also who like go on Reddit, right? And
yes.
like they read all the comments on Reddit and say like, well, this is probably what it is, and it's like it kind of leads them towards like a cancer diagnosis, right? But they just have something that's like musculoskeletal, but they don't know they can't diagnose themselves. But I feel like
Exactly.
with this type of personality, they can, go on Reddit, they can go on like social media, they can go on like, like use Claude, ChatGPT or Gemini, and they'll just like look for like the worst possible case, the worst possible like diagnosis.
Oh, I think you're 100% correct on that. I know when people come in, that's one of the first things I talk to them about. I talk to them about, anatomy, and I use the terms that they can use that they may find on social media. And so that they have a lens which to sort of filter that information through, because they don't, we generally don't have good lenses to filter
Mm,
things through. And so we just kind of assume that everything can be generalized to us, when in fact we're so different that it's very
of course.
difficult to do that.
So it's
Good.
almost like, part of like the public floor education is like how to also use, we're also like educators on like AI at this point.
I
Like
didn't
teach
think of,
patients,
oh, go
yeah,
ahead.
it's like teach patients how to use like technology, right? Like health tech.
That's an excellent point. I didn't even consider that. I mean, I guess I kind of was doing that anyway, but you're right. I think that's an important part of being not just a pelvic floor therapist, but being in the medical world at all, right? Is to teach people how to understand what their prompts make a difference as to what uh, the responses are going to be, but also to create that filter. Yeah, that's a great point. That maybe that's where we should move to as
Maybe that's just like a
educators.
natural like progression of our profession, like along with like the changing times, like, just like tech just becoming like more sophisticated. Again, we
Yes.
can't avoid it.
Right. And maybe we don't want to. Maybe we don't want to avoid it, because it can be very useful in lots of different ways. Um, as long as we don't replace that humanity with that the cold hard ones and zeros of the coding, um, because there's healing in humanity, right? That computers just aren't going to ever be able to offer is that shared experience of
Sure.
life in
It's just
general.
like the comfort of like physical touch, right? And like the manual therapy that we provide to patients, that has, we directly touch, bodies, we directly touch tissues. We can assess like, like tightness of muscles, right?
Hmm.
And we provide like that direct care. You'll never get that from AI.
No, no. And there's lots of research out there that talks about just how just touching, just putting your hand on someone makes a difference in their healing experience.
Hmm.
Whatever that is, even if it's just stress urinary incontinence, where if you can't get on a trampoline without using the bathroom, then sometimes going to a professional is going to help you. But I have the same concerns when it comes to some of the other devices that are out there that aren't even AI, but that may be a different discussion, that aren't even AI, that people can just purchase because they're purchasing those things because they think that it may possibly be this issue, instead of just going to someone and figuring it out first and then going in the
But I
right
think
direction.
But I think that's a problem with like social media, right? It's like
Mm-hmm.
social media, they find like all these devices that market to like new moms or, like someone who has like painful intercourse and they're like, oh, it's going to solve all your problems, right? It's just like the amount of advertisement done on these social media platforms.
Yes. Yes. Well, I know. So I did a podcast recently with a personal trainer, and we went through some TikTok videos and went through them just to kind.
That must have been interesting.
It's yeah, you'll definitely have to watch it. But we went through some videos that had or what was it, pelvic floor exercises. They were they were just crazy because pelvic floor is a hot topic right now. So you can put that out
It's
there, and
everywhere.
everybody's going to click on it, even though it has nothing to do with your pelvic floor. It's nuts. But if you say it's pelvic floor, then people are going to look at it because this is the new buzzword. But
I think it's just like it kind of the algorithm, the way that things are set up now, it's
mhm,
like, you do, because like pelvic floor, like pelvic health is like such a huge umbrella and
yes,
affects like so many types of people, like men and women, right? And like
yes,
different age groups. I mean, like think of like how many people, right? Like just like the one term, reaches. It's a lot.
yeah. It's definitely a lot. So when we look at technology, we started this podcast just talking about like AI, but I think going into this broader aspect as to how technology in general, social media, even your Google searches, right? If we even go back there, how they affect not just your understanding of what's happening in medicine and in your pelvic world, but also what information you get, because it's not like reading a book where everybody reads the same paragraph, right? It's more
Right.
like, oh, they're trying to designate it or design it specifically for you. And then you've got the advertisers. Oh my gosh, like everybody's trying to sell you something all the
It's
time.
almost like it's too much. It's like too much out there.
Yeah, and who do you trust? Like, who do you trust if somebody keeps trying to sell you something? Like, you have to be like, there has to be a little bit of some critical thinking involved in who's getting paid for that.
Sure.
Yeah, I don't know. Sometimes it's a good world. Sometimes it's not so great. I don't know.
But it's
It's
like besides pelvic floor, it's like all these other, like what I see constantly on like Instagram, right? It's a lot of like hair loss treatments.
yes,
and into like the lasers, right? And like red light therapy, like, skin care, like all of that. They're like, well, if you have like wrinkles, if you have hair loss, you had a baby and your hair is falling out, like this is what you do. This is what you use. This is what you take. So
And
it's like
everyone,
pelvic floor kind of, it's like, yeah, these are all like, like things that like, bother people.
yes, and everyone's so confident that this is going to solve your problem,
So
and it's very easy to fall into those traps. I Yeah. Wow.
but that's like the power of like, again, like social media and like advertising.
Mm-hmm.
You can like convince anyone of anything, right? Of any solution.
It it doesn't take much. It doesn't take much to convince people. It really doesn't, because we're still like our brains still default to trusting. And so when
It's
you
it's really funny because like a lot of like my postpartum patients, right? Um I remember like just chatting with like one patient and she was like, yeah, like, I was like nursing the baby at like 3 a.m. And what was she doing at 3 a.m.? She's like scrolling through Instagram. And she's like, oh, like, she's like thinking about like, yeah, it's like hair loss. And then like she was like really fatigued and she was experiencing like leaking. So then all of a sudden, like Instagram was like bombarding her, right, with all these like products. And I
Mhm.
think at that time too, it's like being like sleep deprived, like she's like vulnerable. She just started shopping
Yeah. Yeah.
at like 3 a.m.
I mean, I'm guilty of shopping at 3 a.m. too. But it's not good. I try not to do it. Not for those things. But you know, and it's just it's the constant. We kind of veered off, but that's okay. It's just the constant barrage of the information over and over again. So I was looking at uh I travel. So I was looking at these vacuum bags, where you pack your clothes and then you vacuum out all the air and put it in your suitcase just to kind of save on bulk. Anyway, I was looking at that, and now I cannot get away from it. It follows me everywhere I go on the internet. And every other post is about different types of vacuum bags. And this one is better than this one. And this one does this. And this one does that. And it is just exhausting. And I'm like, when is it going to stop? It will stop whenever I say something else or look at something else online. But
Right.
just the constant barrage so if I were of the information. So if I were looking at something about hair loss or pelvic floor dysfunction, it would follow me everywhere. And
Everywhere.
who am I going to trust? Who am I going to trust? Because who's trying not to sell me something? It feels like everybody is. It's exhausting. Living in this timeline is exhausting. I'm going to tell you, at least for me.
Well, I think that's like the bottom line, right? Then it's like just go see a professional
Yes.
instead of buying like 50 products, right? And like trying
Yes.
to diagnose yourself.
Exactly. I mean, look at all the mental stress that is associated with these things, which of course is going to affect your pelvic floor.
Absolutely. Anxiety. Yep.
It's huge.
100%.
It's huge. Well, Helen, have we solved all the problems yet with regard to technology and the pelvic floor?
I feel it's gonna be like an ongoing discussion
I feel like it might be
for
for a
many,
long
many, many
time.
years to come.
I agree. I agree. Well, thank you so much for joining me. I hope you'll come back and we'll do another topic. And
It was so much fun. Thank you so much for having me here.
oh, I love it. I love it. So we'll see you again sometime soon, hopefully. And just appreciate your just your perspective on not just pelvic floor but also technology. And it's great. It's a lot of fun to talk about and to see where things are heading. You've given me
Yeah.
more hope than I had coming into this. And some things to think about, which is good, which is good. Hopefully
Different
the people who are
perspectives.
do
Yes.
what?
Different perspectives.
Yes. So hopefully the people who are watching at least get some information about what a challenging topic this is and how complex it is, and that still at this point, going to see a professional, whatever the medical issue is probably going to be the best point of reference. And it's okay to use that information that you get online to help to guide your language when you're talking to someone, but not to be all set on this is the way that things need to be. So
Yes.
I hope that's what people walk away with. If not,
I
they
hope
should
so
walk away
too.
with it now. All right, Helen, I'm going to let you go. We're going to wrap this up. And again, thanks for being a guest, and I look forward to the next time you come. For everyone else who's watching, this is going to be it for today. I just want to encourage you to keep breathing, keep moving, and keep honoring your body because you deserve it. And I'll see you next time.